Hello everyone. In this video I will discuss with you the situation where you start working in a practice or you bought a practice from a previous owner or a previous dentist who has practiced for a lengthy amount of time, or even you are seeing a patient who moved to your area, who used to see their own dentist for let's say 20 years. And in all those situations, you find that there is a lot of compromised dentistry. There's like misdiagnosed periodontal disease. There are fillings with open margins. There are crowns with open margins. There is failed chronic dentistry that hasn't been picked up and hasn't been discussed with the patient before. For credibility, my name is Khaled. I have been a dentist for 20 years. I run my own practice, Lakeside Dental Spa in Harvey Bay in Queensland. And I've been running for 14 years. I took it from 1 chair to 10 chairs and from staff members of 3 staff members to a team of 40 staff members. Now, if for this video, if you're in a situation where you just joined a new practice and you're seeing work from a previous dentist in the practice or currently in the practice that require warranty work, that's a different topic, and you can refer back to my other video about warranty dental treatment. This is purely or simply for patients who has a lot of chronic undiagnosed failing dentistry that has been seeing a dentist for 10 or 15 years, whether their previous dentist they moved to your area or you bought a practice or an old associate in the practice, and they have a lot of trust in that dentist. And sometimes when you bring up all those problems, and especially they coming expecting a checkup, they tend to not trust you and resist you and end up trying to go back to another dentist. So if you have faced this problem, you probably have faced it a few times and you're getting a lot of rejection, I'm going to give you a tool that I used, and I've been in that situation before because not just my own practice, I bought other practices as well from previous owners, and some of them probably I face this kind of challenges. And my approach is very simple. I would take as many photos as possible, as many radiographs as possible. I do something in primes, speak what we call it eavesdrop exam. So I'll tell my patient, look, I'm going to say some notes out loud to my dental assistant. Please don't worry about them. I'm just recording my notes and my findings. I'll explain it to you at the end. Now, when you talk about the patient, not to the patient, sometimes they tend to listen a bit more. So I'll tell my DA, hey, can you please note on the right side, on the top right side, there's a crown. I can see a gap between the margin of the crown and the tooth. I can also see some softness, probably there's some decay and bacteria growing there. The tooth on the left side, when I'm putting my dipstick to measure the space between the gum and the bone, I can see like a 5 millimeter of space, which is not enough for the floss and the brush to get there and clean this area. So not just I'm writing my notes, the DA is writing my notes for me, but also the patient can hear those problems without even talking to them. Also, when I sit them up to discuss the findings, I will have to be very honest and I have to preempt what they think before they even think about it. So I'll tell them, look, I understand completely. You have been seeing Dr. XYZ for the last 15 years. And I can see from the notes you have been getting checkups every 6 months. And during those checkups, you didn't require any work, and you've been given the green light that everything is good. Is that correct? Patient, yes. So patient is agreeing with me, yes, that's correct. I also understand that it's my first time to see you today. You don't know me. You don't trust me yet. And you're probably expecting from me to tell you that everything's okay and give you the same green light you've been getting from your dentist that you trust. Is that correct? Patient said, yeah, that's 100% correct. Now, I'm in a very awkward position and I need your guidance. If I'm seeing some problems, and those problems are chronic, which means they're not probably giving you any pain, and given that you don't know me well enough, you might not trust me, and you trust your dentist well enough, would you like me to be honest with you with my findings, risking that you might think, I'm not trustworthy, and risking that you might lose me as your dentist? Or would you like me just to tell you, give you the green light and ignore what I see today? Now, if you're sincere and your body language and your tone is open and you're honest and you're humble about it, most people will have a little bit of doubt now. It's like, okay, hold on. Maybe this guy is honest. Maybe my dentist, I've seen, maybe I think my dentist was into retirement and was relaxing a little bit. So maybe I should hear them out. If you approach them from this angle, they will tell you, yeah, I would like to be honest with me. Everyone wants you to be honest. Okay, just to clarify, I will be very honest what I found today. Again, I'm risking I might lose you, but if this doesn't make sense to you, I can describe it differently. If you don't trust what I said, you want a second opinion, I completely understand. There's no hard feelings. Again, I'm stepping back. I'm not pushy. And then I'll explain my findings. I will show them the photos, I'll show them the x-rays, and I'll give them the options available. You can do nothing. There's a risk you're going to lose all your teeth from perio in probably a few years. Or we can go through gum treatments. It might involve sessions and cost, and I know you didn't expect that, but that's the only way we can fix it. And step back and let them decide. When I did this approach, and I was honest and sincere about it, I very rarely faced any problems. Maybe I lost 2%, 3% of patients, but trust me, 97% of patients, they start to, they understood that you were honest, and they felt the trust, and they eventually trusted me, and they stay with me. And it was very hard for them to see my associates now when I want to eventually have more patients than I can handle, and I have to give them to my associate. But because they trust me enough, they trust my associate as well. Try this way, and if it's working for you, it's great. If it doesn't, let me know what works for you. I hope you find this information helpful. Make sure you like and share it to your friends and colleagues. If you like my content, subscribe to the channel. I will supply you with more content. Thank you so much for listening, and I hope you find this beneficial to you. Thank you.